So if you caught my last video, you'll see me, I'm talking about the upper neck, your C1 or your C2, the very top two vertebrae in your upper neck here. Talk about the brainstem and then the vagus nerve and how all that relates to your nervous system, especially your parasympathetic nervous system, which is your rest and your digest. Today we're going to talk about the sacrum. It's this big triangle bone you see here from the back side here. If you put your hand kind of on your pelvis, on your hips, those little bumps you feel, that's usually on that like sacral iliac joint, we call it. And your sacrum or your tailbone, people call it that, sits right down there. So why is this so important? So we have our pelvic joints here. Our femurs, this is from the backside. Our femurs sit inside these iliums here, and they articulate and they move when we walk. They move when we walk. They move when we go up and down stairs. They move if we're sitting, they go on standing. If we're going from a standing to sitting, all that motion and movement comes through these joints down here. When you sit down, all of our weight sits down here because it's our foundation of our spine. It's really the big bone in our low back and our pelvis that supports our whole spine all the way up. There's a lot of muscles on the front side and the back side. You've probably heard people talk about your hip flexors. You probably heard people talk about the glute muscles or your piriformis muscle. A lot of different muscles that can get tight down here, usually due to restrictive movement or a misalignment of that sacrum. This is really important for people that sit a lot. If they sit and they get up and they're like, hey, my low back's always stiff when I go to stand up. It takes me a couple of minutes of walking to get to loosen up. Maybe you wake up in the morning and your low back's stiff. Maybe you've noticed if you're sitting and you try to raise a leg or you get up to stand from sitting or walking, you'll hear a click, 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 popping or like little clicking in the front of your hips or pelvis down here. It also impacts that function of your actual hips where your femur goes in and your knees and your ankles. If you have a kind of like how this picture is here, if it's tilted a little bit one way or the other, it's going to mess with your gait or how you walk. And it's going to also impact the structure of the spine all the way up to your neck because this is the bottom. The bottom is the foundation of the spine. So super important. Just like how I talked about in my other video, I always check C1 and C2, that upper neck, because of how important the neurology is there. I also go down and I always check the sacrum and the pelvis on all my patients as well, because how important it is for the foundation and the movement of your spine and the pelvis all the way down to your feet. Speaking of their neurology or the parts of the nervous system that come from down here, we have a lot of innervation to the bladder, reproductive organs, and just the muscles in the area through the glutes and the low back. And then we have that sciatic nerve people have talked about, you probably heard about as well, that goes through there too. It's a lot of different issues, not just if you have low back pain, not if you just hear some popping and clicking, not if the muscles are just tight, maybe you're walking, you're having some knee issues. A lot of these things can be addressed by working on the sacrum because of how important it is and where it sits in the body. We take x-rays here in my office, so I always look at the sacrum, make sure it's not leaning one way or the other. A lot of times people have it where it's tilted too far forwards, and it will cause a hyperlordosis or an extra curve in the low back, and sometimes it's sitting backwards where it starts to straighten out your spine. So I'm always checking the motion, the function, and the biomechanics of that sacrum down there. So there you go. That's the sacrum. All right, guys. So that's a little bit about the sacrum, the big bone right down here at the bottom of your back, your low back. You're sitting on it right now if you're watching this video, most likely, or you're using it if you're walking as well. You use it every day. I mean, if you stand up, if you walk, you sit down, whatever you're doing, there's usually going to be involving that sacrum down there. If you're having some low back issues, some sleep issues, maybe even some bowel issues, if you're just were pregnant or had a baby, or you are pregnant at the moment, a lot of times low back pain is going to involve that sacrum area down there as well, just because you're growing a baby down in there. Yeah, if you're a runner, if you're an athlete, deadlift, lift weights, all that stuff is involving the sacrum. So even if you don't have any pain, you're sitting on it, you're using it, I would recommend go get it checked by a chiropractor. We're pretty easy to work on them. I'm going to put some videos here right now that you can see me actually adjusting people's sacrum and that pelvis, making sure their body's doing what they're supposed to do so they can live the life they enjoy. Stay tuned. If you have any questions, leave them below in the comments. Send me a like or give me a like. Subscribe to the videos. I post stuff like this regularly. Try to help you guys learn a little bit about your body and what chiropractic does, and or not just pain-based, but we're actually about improving the whole function of the movement of your spine and the neurology and the nervous system function there That's the most important organ system we have. So brain, spinal cord, all the nerves that exit. If we don't have it, nothing else is going to work. So stay healthy. Go see your chiropractor. If you have any questions, let them drop them below. Thanks.